Hello, everyone, and welcome as you are joining our program. We have a few more folks coming in right now, so we will get started here in just about a minute or two. We have a fabulous panel for you today, really fascinating insight on a really important topic of mental health. And combined with our topic for the year at Arizona Town Hall, which is workforce development, but this will specifically address mental health and workforce development. I will give it just about 5 more seconds, then we will officially get started. And the countdown is complete. There we go. A couple more participants coming in. Wonderful. Well, an official again, welcome to all of you who are here for this webinar that is part of our Cross-Border Connecting series. We've been doing these webinars since 2020 as part of our International Relations Committee, which historically is really focused on our relationship with Mexico and Arizona, but has expanded to include many other countries who we partner with to bring programs that matter to everyone. Today, we have a wonderful program, really relevant and timely, and also connected to our official topic for the year of workforce development. Before we get started with that program, I just want to give a quick shout out to our financial sponsor for this particular program. I think we have a slide that will just pop up there. The programs themselves are sponsored by the Nelson Family Charitable Fund, who's been an amazing sponsor for these particular programs with our International Relations Committee. And then we also have always collaborating partners as referenced on the slide. So thanks again to all our supporters and our speakers who are part of our collaboration as well. Let's go ahead and take that slide down. And we could not do these programs, which have been phenomenal. If you've missed any of them that we've done this year, I would highly suggest, if you're interested in workforce issues, to look at our website or our YouTube channel, where we have some of the programs, well, all of the ones we've done this year recorded, all on workforce development, really interesting on-point topics, including AI and some others. And we have some more coming up. So they are there if you missed them. But now for today, and the person who really takes the rowing oar on making these programs happen, that is Dr. Linda Elliott-Nelson. She retired after a very accomplished career in higher education. Her retirement is much to the benefit of the entire state of Arizona because she volunteers in so many ways throughout the state, bringing her leadership and her knowledge to simply making not only our state, but our region and even the world through the International Relations Committee a better place for all of us. She has arranged an amazing program today. And so I am going to turn it over to Linda now to run the program for us. Thank you so much, Linda.
Thank you, Tara. Yes, this is a topic that is a priority both in the United States and in Mexico. In particular, I would like to thank the Institute in Mexicali and Baja California that has helped us throughout the years in collaborating with us on speakers and on topics. And that is the Universidad Autónoma de Baja California, and in particular with the Centro de Educación Continua. I would particularly like to thank my colleagues, Dr. David Toledo and Dr. Manuel Durazo, for their help with speakers and with the topics over the years. We have 4 great panelists that give different perspectives of the lens in mental health and workforce development. Our first panelist is Mabel Coronel, who is a therapist at Child and Family Services of Yuma with over 6 years of experience across a range of behavioral health settings, serving both adults and children. A proud Yuma native, Mabel holds an Associate of Arts in Psychology, a Bachelor of Arts in Psychology with a minor in Sociology, and a Master's of Social Work from Northern Arizona University. Mabel began her career providing direct care at an inpatient psychiatric hospital in Chandler, Arizona, where she supported both youth and adult populations. She later served as a case manager for court-ordered adults with high needs and has since grown in her current role as a child and family therapist and group facilitator. Mabel's work spans clinical therapy, crisis response, and social emotional learning initiatives. In addition to her clinical work, Mabel has led community-based programs, including a children's therapeutic group inspired by the Incredible Years Dinosaur School curriculum, helping young children build skills in emotional regulation, friendship, and problem solving. She has also facilitated chair yoga classes for seniors in long-term care settings. She brings a unique perspective on discipline, focus, resilience, and empowerment through her background in her training in judo. Mabel is guided by her belief in the power of relationships and resilience and centers her work around connection, creativity, and culturally responsive care. She is passionate about building accessible mental health supports that meet people where they are, culturally, developmentally, and personally, and continues to advocate for integrated community-centered care in underserved regions like Yuma County. As an early career clinician, she is equally passionate about learning and growing in her field and about fostering healing relationships that lead to lasting change. Please welcome Mabel Coronel.
Hi, everyone. Thank you, Linda, for that introduction. I'm excited to be here with all of you and to talk about my journey and the mental health access in Yuma. Just give me 1 second so I can pull up my presentation. Okay, can you guys see my screen okay?
You can.
Yes, it's there.
Thank you. So just a little bit of introduction of who I am. I know Linda just talked about who I am, but oops, sorry. I am currently a mental health child and adult therapist in Yuma at Child and Family Services. And so we're a small nonprofit that really goes out of our way to try to help out the community as much as we can. But I have experience in a lot of different roles, including being a high needs case manager, working at an inpatient unit in Chandler, and leading a group for 4 to 8-year-olds. So I've definitely gotten a good taste of what it is like to work in Yuma in the field. And part of the reason why I keep going is because I've grown up here in Yuma and I've seen firsthand how much mental health support can impact a family, but I've also seen how hard it could be to access it for some families. So that's a big reason why I keep going and why I care about being in the community so much. So I wanted to talk a little bit about the road to becoming a social worker, because actually this is something that I've been experiencing and learning a little bit more about myself recently, because I just got my master's in social work. But the licensing process, and it's very intimidating. It includes a lot of years of training, learning, and education. So first off, you get your master's in social work. That is the minimal requirement in order for you to be able to move forward. So in the process of getting your master's, you participate in field placements with real clients where you earn hours and you're under a supervisor that has a certain licensure in order to be qualified. Then after you finish your master's, you jump into the process of licensure, which in order to be an LMSW. So there's a lot of acronyms of social work. There's LMSW, there's LCSW, and you just keep adding letters to it, honestly. So in order to be an LMSW, you apply for the licensing through the Arizona State, and you have to pass an exam that is laid out with all this different information of stuff that you learned throughout the field, working in the field, and also throughout your master's program. And once you pass the exam or you gain a temporary license, you could start towards your supervision hours, which your supervision hours need to be under, again, kind of like your field placement under someone that has the right licensure that would be applicable. And you need 3,200 hours for that. And during that time, you're getting your supervision hours and you're working directly with clients. And after you get all of those hours and you pass the exam, then you could apply to be an LCSW, which is basically just the next level unlocked. And you could start getting to that point where then you could eventually be able to supervise people. And when you're starting off in the career, you usually start off in, or it's very possible and very likely to start off in community mental health centers, schools, and just or hospitals. And social workers have a tendency to meet people where they are literally and emotionally. So it's a very diverse field, but I'll go to that in the next slide. But supervision, which is the licensing hours that we get, is part of a very collaborative relationship that you build with your supervisor in order to continue to learn. So it's all about continuing to learn more and to grow. And it's actually really amazing because it encourages you to step out of that comfort zone and ask those questions. And then they have education hours, which once you get your license, you're required to complete a certain amount of education hours, which is, again, just encouraging that extra learning and making sure that you stay up to date with everything that's going on in the social work field. So it's constantly developing and changing, and it's amazing. So going forward, talking about how diverse it is, these are some potential social work career paths. And so those include being a therapist, that's clinician, so that's where I am. Being a medical social worker, being a social worker that works in schools, working in the crisis legal system, or working with policy and advocacy. So as you can see, all of those are, again, like I said, meeting people where they are literally and emotionally. And social workers can be everywhere. They could be in clinics, they could be in courtrooms, they could be in schools. So for example, a school social worker is one of its main purposes is to coordinate services between the home, the community, and the school. So to be the middle person that just makes sure that we're advocating and empowering all of our clients and the community that we serve to the best of our abilities. So going back a little bit to the mental health access in Arizona and in our rural community like Yuma. There is a shortage, and it could be difficult to obtain the services just because there's not enough social workers to go around when somebody needs help. So in this chart, it just shows that in Yuma County, for providers per 100,000 residents, there's 39 providers, whereas Arizona, there's 79, and the national average is 139 providers. So it just gives you a really big picture of how many people are at risk of falling through the cracks and or being left behind, or that just don't get the services needed in general. Which leads me to a little bit more statistics and information about the Arizona mental health crisis. So 90% of people in Arizona have their unmet mental health needs. So that means only 10% of people are getting the help that they need. And in Yuma specifically, there's 8.2% of people who attempted to get the care, but had difficulty doing so and weren't able to obtain the care that they needed. So even if they want to, it's like we're making a lot of the little bit that we have, but we're still hitting walls. And for the Arizona student counselor ratio in regards to schools, the amount of students assigned recommended is 250, but we are 167% over that recommended one for every student counselor in Arizona, or on average. So going a little bit more of what mental health looks like in Yuma. So as a community, we have lots of strengths, including the strong family networks and the cultural resilience that we have. And just the way that we're able to all come together and support each other. It's a tight-knit community that really just wants to support, and there's hope and there's healing possible. And there's growing access to mental health needs, and people who are more often asking for the help, and they want the help, but they just need access to it as Yuma continues growing. And the challenges faced include, however, the lack of culturally competent services or limited services. And the long wait lists and burnout from the providers. There's a high demand for families and low access care, and then there's stigma around therapy depending on the culture. And there is few resources for the people who are uninsured or undocumented. For example, at my agency, we work with the state insurance. So we are limited when someone loses their insurance or has a change in insurance that we don't accept. And that is often, or I've seen it lead to a discharge where we're unable to continue seeing the clients. And there's a lot of people in Yuma who aren't insured or who have an insurance that isn't applicable to some of the agencies accepted. And so getting mental health care actually ends up being more expensive for them and more unaccessible for them. And of course, the burnout among providers, because again, there's only so many of us available. So providers are really doing their best with the limited tools we have, and we're trying, but we're still hitting those walls, and the gaps they're real and they're heavy. They're very prominent. Moving forward into some system level needs and community level needs. As social workers, some of the system level needs are, ensuring there is access to more licensed mental health professionals, which is something that's amazing that we're having this forum and this program in general and being able to talk about the resources that are available. So there's free or low cost. We need free or low cost services for the uninsured or undocumented. We do need some more bilingual and culturally competent, because sometimes that could be a barrier to some people for not being able to seek their services because they don't feel safe or they don't feel heard, or like their providers are there for them to meet their needs. Some more accessibility to school-based mental health programs that could help out our students, meet them where they're at. And in order to prevent burnout, increasing the pay and increasing support providers. In regards to community level needs, it's more in mental health education and resources being provided to reduce the stigma, and parent and teen support programs, early intervention, especially for the littles, because in my experience, I work a lot with young children and teenagers, and there is a lot of teens that go undetected and until they are having a crisis. But I do see that change happening by the parents we do call, the kids that do speak up, and the teens that do show up. So after all of the statistics, this is my why. So this is why I love to give back to my community and why I believe hope and healing are possible when given the chance. And my big belief is showing up matters, is just being that person for somebody and giving back to the community that I love. The work is hard, don't get me wrong, but it is real and it's human and it matters. And my clients leave as much of an impact on me as I leave on them. And I learn every single day from them. And so some of these pictures here I chose specifically because they're some of the highlights and some of the things that I keep close to me. So this one on the top left corner with the handprints, it is actually a friendship tree that I created with some of my kids. And so each of them got to put 2 hands on there in different colors. And we ended up hanging it up on the board as a way to show that they were all bonded and working together and that collaboration. The next photo of the paint splatter on the top right hand corner is the family therapy activity that I did with a mother and her daughter. And for each of them, I had them pick their various colors and splatter their feelings. And they had been having a lot of conflict, a lot of miscommunication between the two. And this was the first time that they had actually paused and just enjoyed being around each other. And then afterwards, we were able to explore what each color meant and what each emotion meant to them. And it was really fun. My kiddo actually continues to use her paint splattered shoes every time she comes to session now. The bottom left is actually a graduating class for my group that I facilitated. So this one, I did 3 cohorts before I switched, and currently I'm paused from doing my group. So this one had 7 graduates, and all 7 of these kids, I spent 18 weeks with teaching them the different skills. And then at the end, we get to do this big graduation ceremony where we just appreciate them and talk about everything that they've learned and just have them show the skills, including things like their deep breathing and then the songs that we teach them. And the last thing, on the bottom right, this is affirmation hopscotch. And so I did this with one of my 7-year-olds that had really bad self-esteem issues, to the point that she had trouble going to school. And this is when we were first starting off, and actually now she's preparing for discharge. But each one is, I am brave, I can do it, I'm nice. And so the way that we did it was we threw a rock, and whichever one she landed on, she had to give an example of a time that she felt that she was brave or that she was nice. And just one of those introductions into being able to practice those affirmations and that positive self-talk. So this is just a little bit of the humanity that I see every day and the creativity that I get from my clients. And I do want to give some appreciation to Yuma, because Yuma is growing and change is happening every single day. Again, the way that we're having this program, we're seeing change from the ground up. And we're working as a community to build the infrastructure to meet this movement. And actually, this You Are Not Alone is from Yuma High, when they had a week of mental health awareness. And one of their days was a chalk day, that all the kids were encouraged to go to the front of the school and draw various things. And so this was something that really stayed with me, because they actually had my agency go and speak at their mental health week. So that was something that was very special. And thank you all for listening. And please, if you have any additional questions, reach out to us at Childhood Family Services or to me. Use my information and some additional crisis lines for you guys as well. Thank you.
Thank you so much, Mabel. That was very helpful, very insightful with everything that you covered. We really appreciate it. Our next speaker is from Baja, California. Dr. Alfredo Padilla-López is a psychologist who studies the neuropsychology and psychophysiological basis of behavior, training and professional practice in psychology and ethics in professional practice. He has contributed to the design and development of projects of the National Council for Teaching and Research in Psychology, the National Federation of Colleges, Societies, and Associations of Psychologists of Mexico, the Mexican Society of Psychology, the Mexican Association of Neuropsychology, the Mexican Association of Researchers and Professionals of Organizational Communication. He has also collaborated with psychology professors and researchers from various countries in Latin America, the United States, Europe, Asia, and Australia. He was a member of the Standing Committee on International Affairs of Division 29, Society for Advances of Psychotherapy, of the American Psychological Association. He is currently a member of the Bachelors of Social Work Advisory Board of Northern Arizona University, past president of the International Council of Psychology Educators, and member representing Mexico in the Global Psychology Alliance. He has received the Mexicali Institute of Technology Medal for his career in science and the 2024 American Psychological Association Presidential Citation for his outstanding leadership in Mexican and global psychology. In addition, he is co-author of the Dictionary of Neuropsychology, Editorial Manual Moderno, and the book Teaching Psychology Around the World, 4th and 5th editions, Cambridge Scholars Publishing. Please welcome Dr. Alfredo Padilla-López.
Thanks a lot. Thanks a lot for this opportunity for share with you some data about mental health and workforce development. Please let me know if you can see the presentation.
We can see it.
Okay, perfectly. Okay. Well, I'm talking about what we do, like a research team in UABC about the mental health. Let me talk first time about what's mean mental health. Mental health is a state of well-being in which a person releases their capacity and is able to cope with the normal stress of life, work productively, and contribute to their community. This concept is interesting because um, this concept tells us about the three conditions for the mental health. One condition is for individual, for psychological and symbolic situation is the well-being. Well-being is psychological situation for only for individuals. But another topic in mental health concept is what do you do with this well-being? Well, you need potential make with this well-being you need potential your capacity like a person in all terms, capacity to socialization, capacity to work, capacity to think, to art, for everyone. But the third condition for mental health is if you has a well-being and you can use for you develop your person, okay. And the third condition is okay, help another person with these abilities and this condition of health. You can um, you can use that condition for help another person in your community. Your community is a near community or global community at any side. For this reason, mental health concept is interesting to me because is three moments, three situations in the life of the person, individuals, like a person, social persons, and you in your society. If your society is have well-being, you has well-being. It's interesting. For the reason that the mental health, like a concept for a social vision, mental health is a featuring for public health. If the public health, excuse me, the mental health is a portion or yeah, it's a portion of public health, but the mental health is create the well-being, psychosocial well-being, and psychosocial well-being construct the social security. If you have like a society social security, you make a socioeconomical stability. For the reason is very important to understand the mental health like not like individuals, is like a social construct. Not we can exist like an individual if you don't have mental health like a social group. Okay. um but the mental health have challenge. This is only some topics for all days. For example, in economical instability and social violence around of the world. In this moment, we have more or less 25 civil wars or invasions, um, wars, the country by countries. Is 25 around of the world. Is too many wars in this moment. Another challenge is the lack of resource and intellectual capital. Um, we have some problem with that because um, the the increases in the incidence of emotional disorders is a big problem for all people around the world. Um, for because with the emotional disorders, we has like a results the lack of resources in intellectual capital. Um, another challenge for the mental health around the world is reduction of cognitive capacity, and evolution of artificial intelligence. We know for too many studies in different countries around the world that the increase of the evolution of artificial intelligence uh, is a precursor for decrease in the point of cognitive capacity. We don't need more abilities for memory. No, we don't need more abilities for socialization. We don't need more ability for mathematical processing. For the reason we need to take in count these topics, all these topics: instability, economic instability, lack of resource of intellectual capital, increase in the incidence of emotional disorders. Yeah, it's very important. Take these notes. In another topics, mental health is right now is a very important topic for UN, for United Nations. Because the global health organization, is World Health Organizations said never has it been more necessary to priority, excuse me, my pronunciation, mental health than now. The triple impact of COVID, climate change, and ongoing wars and conflict exact a very high toll to our populations were affected directly and indirectly. In this moment, the United Nations is make a process for strengthening the mental health. In September 25, the United Nations they had a fourth United Nations high level meeting for non-communicable disease and mental health. Historically, this is the first time in the United Nations in a high level meeting they treat the mental health like a main topic. For me, it's incredible. It's the first time in the high level meeting in UN they treat the mental health and incorporated this topic for create new laws, international laws and agreements for attending mental health conditions, like solutions for too many problems around of the world. In May, the last May 2 of this year, we working together as a global mental health action network and Global Psychology Alliance and too many association of psychologists working together in the UN sessions for talk about how we can strengthen the mental health. This is the main topics we tried in this process. This is a key uses defining in the zero draft for the political declaration of the United Nations. They tried put in the document, in the official documents, these 5 topics: create, help, promoting environments, thought action across governments, strengthen the primary health care, increase sustainable financing, strengthen governance, and strengthen data and surveillance to monitor progress on all observers, hold ourselves. Well, you can review these documents using this QR. For in another side, I'm working with the Global Psychology Alliance. We make a meeting in the last March 2019 to 2022 of March. We make agreement for working in 4 topics, general topics. Let me say, the Global Psychology Alliance is an alliance for 18 organizations of psychologists around of the world. Is for 18 countries around of the world, and we according working together for 4 topics: mental health, climate change, psychology and artificial intelligence, and human rights. For this, in this aspect, I'm working in the global mental health working group, like a co-leader in this alliance, and Veronica Kurmanova from Czech Republic. We are the co-leaders for this working group, and we take 4 topics, specific 4 topics for global mental health main topic. We try support the well-being, reduce stigma, public policies, participate in public policies on mental health, and create some strategies for professional training for primary cares. It's a big project because we try impact around of the world in these 82 countries, propose some strategic for general problems about the mental health. This is a description of strategic programs, particularly for psychology in this in my country, and it's in my country, but it's incredible, but it's the same situation in around of the world about the training and develop of professional in psychology. I know it's incredible, but in the Japan, Germany, in Australia, Mexico, Spain, India is the same problems, with different level for attending, with different level of supporting, but it's the same topics. It's incredible. I divide this condition in 3 topics about the training, the enrollment, training, and graduations. I put these main conditions for or challenge for attending the problems or challenge in the enrollment. For example, the family economic stability, academic supply and available scholarships and opportunities, technological and academic infrastructure, resource and social infrastructure. I told about that because we think we tending to think the our problems in the local city or local region is only problem for me. Is the same problem for all, but in different continents and different countries or region of the world, it's the same. In Latin America, for example, Central America, they have too many problems for enrollments in the universities, mainly because the family economical stability is so difficult. But in USA, Germany, and Australia is the same. They need you need think if decide if you take the I don't know the college or university, or you want a university for 2 years, for 4 years. Is mainly is a economical problem, not is a personal of decisions only. But if you stay enrollment in the program, university programs or college program, or graduate program, the main problems or the main topics is the quality services of the higher education institutes. The services of this organization is of the quality, or is only for stay in the higher education programs. The access to training experiences, in the reality activities on the real activities for working is the main change, because in Africa and Latin America and some countries of Asia is normally participate in realities activities of the programs, but in the rest of the world, not is coming. It's only training in theory. Excuse me, I passed my time.
Oh, we have 1 more minute.
Okay, and then in Baja we have some problem with enrollments. In the 10 years ago, we had the increase the enrollments. We have more opportunities for the people, but our main challenge is the completion rate. It's only 76%. For another topics, for example, we tending to think about the mental health problems like a consequence of COVID, but for example, anxiety in the case of students in the university, the increase not begin with COVID. With COVID, it's exponential, that this topic, but not begin with the COVID-19. We need to think about what we need more psychologists in our region. We need another kind of psychologists. We need more international collaboration. We need more psychologists with clear comprehension about the social functions, how the society works, like that. And I think the psychology, like a profession, tending to create a global identity or an ethical and legal regulation for working around of the world, not only in a region or country or states. Is the next generation of psychologists, they need to work in like international psychologists, and the more participation in public policies, and we need attending more programs or create more programs for attending children and adolescents like a priority. This is my topics. Thanks for your attention. Excuse me for my English is so bad. But
Your English is very good, Dr. Padilla. Thank you so much for your insightful presentation. I know that I learned a lot from that. Should any of the people attending wish to ask questions of the panel, you can click on the Q&A icon to put questions in, and we will also have time after the panelists have spoken for some questions from the audience. Our next panelist is Jordin Aguilar. Jordin Aguilar coordinates the planning and implementation of a comprehensive community education program to promote the unit behavioral health program and services. Jordin graduated from Northern Arizona University in Flagstaff, Arizona, with a Bachelor of Health Sciences and a Master of Public Health. She currently resides in Yuma, and she's originally from New Mexico. Please welcome Jordin Aguilar.
Sorry, forgot to unmute myself. I hope everyone can hear me. Thank you, Linda, so much for the introduction. My name is Jordin Aguilar, as Linda mentioned. I'm from the Pueblo of Giwa in New Mexico, as well as the Navajo Nation in Arizona. I also come from a small rural town, although I do live in Yuma. not very much of a difference, but I'm always happy. I'm happy to be here in Arizona, and currently I am the community education manager for the Onvida Health Behavioral Health Center. So I'll just kind of jump right in. Let's see. Whoops. Okay. So on just a little bit about Onvida Health. Most people do remember, if you are from Yuma, most people remember Yuma Regional Medical Center. More recently, Yuma has transitioned a whole new marketing brand for Onvida Health. So now with that just on this slide is just a little bit of information, but I really want to focus on why Onvida decided to bring about the Behavioral Health Center, which is what I'm going to focus on today. But in 2022, Yuma had conducted a community health needs assessment, and within that, mental health was identified as the #1 concern among the key informants. I know Dr. Padilla talked about a lot about that, how mental health needs to be a focus, especially in regard to bringing more psychologists to the states, and more so especially to Yuma. And I know Mabel did touch a lot about touch on the demand for more mental health resources in Yuma, as well as identifying those mental health care gaps. And so Onvida is doing its best to bring more behavioral health resources to Yuma. Anyone who is here understands that when you cannot find a specific service that you need, you're gonna have to travel to San Diego, or you're going to have to travel to Phoenix or Tucson. For children, it can be especially challenging when your child is having to seek services elsewhere. And as a parent, you're going to have to travel with them. But it can also be just as difficult for an adult, because traveling every day or every month to pick up, to meet with your therapist, we want to do our best to bring those services here to Yuma so that people don't have to rely on outside places and they can stay here with their families. So to help with this, in response to this community health needs assessment, Onvida Health decided to open a behavioral health center, which included the inpatient mental health unit and the intensive outpatient program. This opened in February of 2023. It really started out as a slow rollout. So it did start off as direct referrals from our own Onvida Health internal emergency room. So they had to go through the emergency room before they could be admitted to us. We've since expanded so that our unit is open and available 24/7. Anyone can walk into our unit at any time. I'll jump on to the next slide. So here is within our behavioral health center, we do only provide services for adults 18 and older. We do work in collaboration with our outpatient unit. Onvida is now working toward building a behavioral health campus within where our new building is located. I'll touch a little more on that later, but within our behavioral health unit, we offer, like I mentioned, the 24/7 access. Although we can offer services within our facility, anyone can walk into any Onvida Health site and receive those behavioral health services. So if you are at an outpatient clinic or within our emergency room, you can request a behavioral health assessment, and we will send one of our nurses, or we can evaluate over the phone to send someone there and bring you to our facility if that's what's needed. We're doing our best to kind of bridge that gap when it comes to transportation. And then also we have the inpatient mental health unit. We also have intensive outpatient programs. I'll touch more on that in a couple slides. But to help foster the communication, because our unit is on its own off-site compared to the main hospital, we have an emergency behavioral health crisis assessment pod, where it's our psychiatric nurses and or behavioral health technicians that are staffed in the emergency room. So anyone who walked into our own unit could receive the same kind of crisis assessment and one-to-one face-to-face care that they would have gotten had they come to our unit. And then, like I mentioned, those off-site or technically on-site, but off-site for us, crisis assessments, where our staff drive to those outpatient clinics and they provide those one-to-one face-to-face assessments. We find that within this smaller community, it's easier or it's best practice to have that face-to-face connection versus that virtual option, which tends to be the fallback Yuma has to use, especially when it comes to our providers, the psychiatrists. We have to rely on that telemed, the virtual aspect of receiving care. Within our mental health unit, we pride ourselves on having those psychiatrists and or psychiatric nurse practitioners here on site. So when someone is admitted into our behavioral health unit, they are seeing the psychiatrist one-to-one. They were actually sitting down and spending as much time as they need with the psychiatrist, as well as the case manager or social worker. And then we do have our psychiatric registered nurses, as well as our behavioral health technicians. And like I mentioned, we're open 24/7. So there are always staff engaging with you. Our unit is a 24-bed unit. On any given day, we have up to 14 patients. So the biggest change about our unit and the biggest need that Onvida wanted to give to the community is that our unit is all voluntary, meaning anyone who comes into our unit is voluntarily seeking those services. We really believe that evidence shows that when someone is willing to seek that care, their care coordination, their outcomes tend to be a lot better than if we were forcing them to be there. It can be a little tricky when someone doesn't want to, and we really want to encourage them. But again, we want to put everything on your time, and we just want to be there to support you. We want to be there to get you back on your feet. As you can see, we provide breakfast, lunch, and dinner. Our average length of stay is about 3 to 6 days. Some people, 3 is not a minimum and 5 is not a maximum. Some people are with us a lot longer, and some people are only with us about the 3 days, but it really depends on what people are coming for. We understand that a mental health crisis can look different for a lot of different people. It can be on a very severe side where someone is, actively suicidal. But whatever the reason someone is coming to us, we want to be able to provide that care for whomever here in Yuma, instead of sending them out somewhere else to seek that care. We do provide phone time visitation, and the biggest aspect of our behavioral health unit is that care coordination and discharge follow-up. So when someone does come to us, whatever it is, whatever state that they come to us with, we want to make sure that they're leaving in a better place, whether that's having those outpatient follow-ups set up for them so they always leave here with an appointment, whether it's establishing a new social community agency, or if they're needing assistance financially, or if they're needing assistance with insurance. We want to make sure that we set them up with whatever it is they need to be successful when they're not with us after. Aside from the inpatient unit, we also have an intensive outpatient program. It is a group-based therapy program. It's really for someone who maybe doesn't need to be admitted into a mental health unit, but also someone who's needing more support than just the one-on-one weekly therapies. Here is where we're able to, you're able to build that social aspect, which tends to be lacking when it comes to, especially with mental health. You tend to feel as if you're the only person in the world dealing with that. And it can feel really, really lonely and really overbearing. Whereas with the IOP, you get to meet these other people who are oftentimes going through very similar experiences. You can lean on them, they can lean on you, and you have your therapist, and you still see a psychiatrist as well. We do have 3 groups. They're all in person. And like I mentioned, we want to make sure that we're giving them that in-person experience rather than the virtual experience. And I just want to make sure I touch on the different professional developments we offer here, aside from the actual occupations we have in our unit, we work a lot with Northern Arizona University as well as Arizona Western College. They do provide, also have social work interns who gets to experience both the social work side of the inpatient mental health unit as well as our intensive outpatient program. Trying to make sure I touch on everything else. Instead of having to have our patients come to us and then go to a different unit to get physical therapy or pick up their medications, we try to bring everything in-house so that once someone is with us, they're receiving consistent care and we're bringing all those services to us. So we have lab couriers, we have family nurse practitioners who do that physical medical piece. We have pharmacy technicians, physical therapists. We try to bring as much as we can within our Onvida ties to our mental health unit. And then as far as expanding on behavioral health and trying our best to make sure we're filling those mental health gaps within Yuma. We're going to continue to expand on the IOP. It has been very successful thus far. We've taken a small dive into substance use, which we hadn't done before. We are also expanding our services as we've always worked with adults, but we're creating more services for older adults. We understand that there are a lot of different nursing homes and rehabilitation centers here in Yuma. And so we want to make sure we're still providing that mental health piece for older adults. Like I mentioned earlier in the presentation, Onvida is working to build a behavioral health campus where our inpatient unit is located, which is on the foothill side for anyone who's from Yuma. And then the most important piece has been our new psychiatric residency program. So we're trying our best to bring psychiatrists here to Yuma. And I remember a term I just heard recently called homegrown. We want to bring them here, we want to train them, and we want to keep them here. We want to make sure that we're working to build that professional development, especially in mental health, so we can start to see that ratio of patients to providers decrease. It helps with the quality of care, and we just want to make sure Onvida is doing its best to make sure we're helping in any way we can. And thank you so much for having me, and I appreciate it. Thank you again, Linda.
Thank you, Jordin. That was excellent presentation and very good information on all the changes that Onvida is making to this area. Our last speaker is going to give a different perspective on this particular topic because she's going to talk about a program and how it affects the mental health of the participants. Melanie Baca joined the Center for the Future of Arizona in 2020 to support the day-to-day operations of the U.S. Department of Education and Innovation Research Grant, including scheduling and logistics, communication and implementation support for schools, and support for the EIR Collaborative and the project management team in order to ensure success of project outcomes. Before joining the Center for the Future of Arizona, Melanie worked at Arizona State University on 2 U.S. Department of Education 5-year education grants, a teacher incentive fund project titled Ready for Rigor, and a teacher quality partnership project entitled I Teach ELLs. Melanie began as an administrative assistant on the Ready for Rigor project, and on the most recent project, I Teach ELLs, held the role of business analyst. On both projects, she led the project team and community partners through the application of improvement science, monitoring, measuring, and assessing change in teacher classroom practices, and communicating the broader social impact of grants to community stakeholders. At the heart of each project, she was cultivating a shared purpose by curating a set of experiences and connections around 3 main skill sets: building relationships, project evaluation, and managing the human side of change. Please welcome Melanie Baca.
All right, thank you so much, Linda, for that introduction. And thank you to everyone. Good afternoon. I'm very excited to share some of the outcomes and impact of this recent grant project I've been working on through the Center for the Future of Arizona. It was awarded to them in 2019, and the project is titled Career Connected Pathways. What you'll see throughout this slide deck is pictures of actual student partners that we worked with on this project. So I just wanted to make sure and note that. And one of the questions that we were exploring in this grant project, Career Connected Pathways, was really trying to understand what influences student behaviors with their education and career planning process while in high school. So you're probably wondering, well, what does that have to do with mental health? And well-being. And students are actually, what we're learning from students is that hope and career development have a really strong relationship. So students are sharing with us that hope is a critical attribute in deepening their engagement with education and career planning. So let's experiment for a minute. Let's take let's test drive this idea. So think of a time when you felt hopeful. Think about how that informed or influenced what you were thinking, how you spoke, what actions you took, how that influenced your behaviors. Now let's look at the flip side of that. Think about a time when you felt hopeless. How did that influence or inform how you thought, how you talked, the actions you took? How did that influence your behaviors? When we think about putting ourselves in the shoes of high school students have to make a slew of monumental choices throughout their high school experience that have significant impacts on their future. And what we're discovering through students, from students, is that when they get an opportunity to practice a hopeful thinking process, it really helps them navigate uncertainty. It promotes self-discovery, and it surfaces their hidden potential throughout the education and planning process. And Dr. Padilla, this reminded me of some of the conditions of well-being that you described in your presentation. So what are we learning from students in this project about their experiences with education and career planning? And so we asked students, how do you feel about your current experiences in high school with this process? And what matters to you most? What do you want during high school to help support your education and career planning, to help support your career discovery? So what you see displayed here is a set of quotes from our high school student partners about their experiences. And students describe feeling their perceptions about this process and their current experiences is that they're really playing a passive role, that the types of activities that are delivered, they really don't get to choose. When these experiences are delivered aren't determined by them. So they're just playing a passive role in this process. And what they want is to play a more active role to drive their own education and career planning experiences. They want to personalize it to their personal interests. And so what they need from adults is an opportunity to support not only their personal interests, but how those personal interests align with career interests. What are the career opportunities in their community? And then once they've identified some areas of interest, what are the steps they need to take to help move them closer towards those goals? So when we introduce a process of practicing hopeful thinking into students' experiences with education and career planning, you'll see in this last column of I can, their perception of their ability to take action to drive their own education and career planning process significantly changed. And they describe feelings of hope, right? Feelings of courage, feelings of being able to take action. So for instance, this first one, seeing the options right in front of my eyes, right? That's empowering. That student feels hopeful. This encouraged me to talk to my counselor about college as a real option. So again, seeing adults as partners in the system. So again, empowerment. When we talked to students and gathered their insights about their own experiences, we started to surface some really strong themes over and over again from students. Those themes about their experiences, what they want from education and career planning, is a sense of belonging, a sense of connection, opportunities to make meaning from all the information they're getting, and a sense of agency to drive their own process towards their personal goals. So what they were sharing with us was the description of the components in a hopeful thinking process. And so when students are given this opportunity to center their career exploration experiences around hope that they're actually driving, it has significant impacts across the system overall, not only how they feel, but also new ideas and new ways of working together with adults in the system and how they leverage assets to move them closer towards their goals within the system. So I wanted to share an example of what this process of hopeful thinking looks like in action. So I want to introduce you to a panel of students that participated in our student data advisory team. This is a group of students that are from Yuma, and we asked them to look at all the data that we've collected in the Career Connected Pathways project here at CFA and respond to this question. 78% of 10th graders aspire to continue their education right after high school, but only 48% actually do. Why is that? Why is there a gap between aspiration and action? So as I share one of the students' presentations, I want you to look for, or I invite you to look for, the impact of hopeful thinking on that the student presenter highlights in their presentation, but also look for the impact of hopeful thinking on the student presenter. So thinking about this student and development of this presentation and this presentation in front of educators. So I want to introduce you to Itzael Beltran. He's an 11th grader that attends Cibola High School in Yuma. And this is the title of his presentation, Changing the Ending, Turning Wasted Years into Hopeful Futures. And this is a picture of him presenting in front of a group of about 50 educators. So this is Itzael's presentation. A system failing too many. 34.8% of students reported they didn't participate in any career-connected activities during high school. Only 6% of students experienced internships and only 9% had job shadows or interviews. Nearly 30% of students are still uncertain about their future after high school. So I want you to meet Alex. Alex was a bright, curious student, but in high school, no one told him what opportunities existed. Course selection felt like picking random classes off a list. No counselor ever sat down with him one-on-one, and he never knew about internships until after graduation. At graduation, Alex felt lost. No career plan, no experience, no momentum. He spent 2 years working low-wage jobs, still unsure what he wanted. And Alex's story isn't rare. It reflects the experience of 1/3 of our students. So why is this happening? The system assumes students will figure it out, but the data shows they don't. Students mainly hear about career paths through random conversations with friends and teachers. 21% of students don't know how to access career opportunities at all. Parents want to help, but often lack up-to-date knowledge about modern high school pathways. And even when opportunities exist, students report feeling like they discover them too late. So now we want to share a story of another student attending the same high school, but with a very different experience, a story of success. This is Mia's story. A teacher invited her to a coding class. She met with an advisor who helped her map a career plan, and she participated in a fiber optics workshop after a speaker visited her class. Because of those early exposures and personal connections, Mia graduated with certifications and a clear next steps of her future. And today she's thriving in a technology career she didn't even know existed before high school. And this is such a powerful quote that Itzael included in his presentation. Every student deserves to leave high school with hope, a plan, and a future they are excited about. It's not just about what's offered, it's about what's experienced and who gets the invitation to step into it. So in this room of 50 educators, Itzael shared his recommendations to deepen student engagement with education and career planning, and not just a few students, but all students. Guarantee early exposure, build those personal connections, prioritize real-world exposure, and strengthen parent partnerships. So going back to the invitation throughout this Itzael's presentation, not only did we see how Itzael synthesized a lot of data to pull out some of the really areas to deepen all students' engagement with career planning and what's causing the problem. But this also was a way for Itzael to showcase discovery of himself and his own hidden potential as an analyst, as an expert on being a high school student, as a presenter, and the courage to present in a room of 50 high school students. It really was amazing to see the hope in his eyes as he was going through this experience. And it doesn't only affect, a process of hopeful thinking not only impacts the individual practicing the hopeful thinking, but it has significant impacts across systems as more and more students have this opportunity to deepen their engagement through a practice of hopeful thinking. So I just wanted to share a few quotes from students and educators that have worked on this project, practicing hopeful thinking. So a high school student shared that they wanted to take action not only to deepen their own engagement, but to deepen the engagement of their peers. A career specialist at one of our high schools said when she saw students taking the lead, that really, surfaced their passion, and she was way more engaged in her own work as a career specialist. So it really influenced and impacted her. And then another community college faculty member from Arizona Western College just loved to see the confidence that was just being cultivated across the group of students that we worked with, and how that really fostered and cultivated this trajectory of hope, both within the high school and across the high school with the community college. So it had significant impacts across the systems. So now I want to toss it over to you all and ask you, what have you noticed in your own experiences and in your work about this relationship between a practice of hopeful thinking, mental health, and workforce development? So Linda, back to you.
Thank you, Melanie. That was very insightful and great information as well. For our audience, here's a time that if you wish to put any questions in for our panelists, please click on the Q&A icon at the bottom of the screen to be able to ask any questions that you might have. Dr. Padilla, we already have a comment from one of your students who says that she is very proud of you. Of doing the presentation, yes, and the information that you shared. For our first question, Dr. Padilla, you have mentioned this, and Mabel Coronel has mentioned this, and this has to do with the stigma of mental health, how people are afraid to say that they need help, or they don't want to say that they need help with mental health. What can be done to help people not have that fear of reaching out for the help that they need? Dr. Padilla?
Well, thanks a lot. It's a difficult question for answer, because I think if we like a profession, like a psychologist or like a mental health providers services, if we can create a literacy program for all communities, all kind of communities. In this moment, in this time, is more or less easy. Uh, create some kind of documents for literacy videos and audios, and yeah, maybe we need to talk more in the social media, in the social on the public sites about what's mean mental health, what mean mental disorders, what's mean stigma. I think in this moment of our history, like societies, is more easy talk about the difference, talk about the inclusions, talk about the mental health disorders. I think that the answer in the shortly is literacy. In my case, psychology literacy or mental health literacy. I think this is my answer.
Thank you, Dr. Padilla. Mabel, would you like to add something?
Yes, I just wanted to say I very much agree with Dr. Padilla, that I think it's very much about starting the conversation and having the education available. Because a lot of the people, especially in these communities, when Latino communities, it's just those resources haven't been made available, or that the education hasn't been there previously. And so just bringing attention to these terms and talking about it in general is a really good way to get the ball rolling on. This example, like for example, our grandparents, they never had conversations about this. So just normalizing it in general.
Thank you, Mabel. So another question, because this forum does link mental health to workforce development, how can we encourage more people to go into the workforce that works with people in mental health? Any of the panelists? Melanie? Jordin? Okay, Melanie?
Yeah. Oh, yeah. Sorry. I took
Yeah.
a minute to click on my, yeah, in our working with career exploration, and student experiences, one of the key elements of exploring careers is just knowing about them, right? So I love the presentations today, providing a little more color, more detail about what that mental health path looks like in terms of career development. But hands-on experiences, there's nothing that can take the place of a student's hands-on experience. So like job shadows, if there's a way to get some to interview maybe a professional, classroom visits. One of the things we did in Yuma was the thing called industry speed dates. So we'd bring a group of professionals to the high school, and the students got to rotate in groups of 5 to talk with a professional. So that could be another option for students to really have some more one-on-one time with a professional to learn more about what that career is like. So again, just hands-on experiences. Students absolutely love them to learn about careers.
Thank you. Jordin, did you want to add something?
I completely agree with Melanie. We have already been adding we've been trying to expand on the different interns that we offer here. We have the nursing students who do their clinicals here, but we've also expanded to include the social workers. We are just a little bit tied because we only allow adults on the unit, so it's really hard to foster that kind of experience with high schoolers, especially when they're under 18. So the way we've combated that is to do virtual presentations to their high school students. So we're giving them some background on what the nursing students do, and what the nurses on our unit do, and the behavioral health technicians, and someone like myself who's in an administrative background, what all of that looks like in terms of mental health. I do my best to bring our director. She has a plethora of mental health background, and that's our way to do our best to kind of get these high school students and these nursing students to be interested in mental health, or see it and experience it, or at least get a little taste of it, to see if that's something that they'd want to explore. That's just Onvida's way of doing it, in terms of the high school students and these nursing students to be interested in mental health, or see it and experience it, or at least get a little taste of it, to see if that's something that they'd want to explore. That's just Onvida's way of doing it, in terms of the behavioral health center.
Thank you. Dr. Padilla, did you have something you wanted to add?
No. Not really. I'm reading the next question. It's interesting.
Yes, if you would like to address the next question, one of our participants has asked if the panelists have seen any change about before COVID and after COVID, as well as the link between mental health and workforce development. So Dr. Padilla.
Yeah, it's interesting because, but it's interesting to me, the question, because the popular answer is yes, COVID is the main problem, is a devil in the situation, but for mental health disorders, not is the answer. COVID not create or create explosion about anxiety or depressions or like that. It's incredible, but not is the bomb for create the explosive and massive problems in mental disorders. But I have a data about the. We know that in the after the COVID, we have around of the world, we have the increase in the population with anxiety and depression, 14% more or less. In the epidemiology studies, is a 14% is increasing the depression and anxiety. But the main range of age for these increases is in between 19 and 25 years old, and especially and particularly for the people with increases in anxiety and depression is higher education students around of the world. Not as an open population, is that this kind of persons, students, is incredible. I don't know why, but maybe maybe is the increases the using of the social media by internet, and too much time for gamers. I think is it's like a joke, but is really, this is the main topics. That's excuse me, this is too much time for the answer, but this is my positions.
Yes, I think we could talk for 5 hours on just that particular question. Thank you to all 4 of our panelists for sharing your information and your experience on this very important topic. And I will turn the program over to Tara Jackson.
Well, thank you so much, Linda, for another amazing panel. It wasn't lost on me, and I'm sure it wasn't lost on the folks who attended, that a lot of the panelists have a lot of roots in Yuma. Yuma has an amazing resource of people there. And a couple of things I was struck with. One, while a lot of you have roots in Yuma, which of course is a border community, the issues you brought up are, I'm sure, for those who are attending from across Arizona and even south of the border from Mexico, these are issues that I know I've seen, and I'm sure all the communities have experienced. So it gave me hope. I thought, Melanie, I'd use that in some of my ideas, quick summary to close. It gave me hope to realize, thank you, Dr. Padilla, for bringing up that the World Health Organization is elevating this topic, because the more we can reduce the stigma, the more we can address it. I also thought it was really interesting to look at that intersection of workforce and mental health from a variety of sides. If people in a community feel healthier mentally, they make better workers. They are more energized, right? That hope, that ability to do more. If they are students who feel like there is hope and a path or a strategy and they can see the future, they are better able to enter the workforce. So really, those economic developers who may think there's nothing that mental health has to do with their issue are workforce developers. Seems to me they're very much interconnected. So thanks for tying that in. I also want to highlight some of the different policies and ideas or examples that you all brought up that are extremely helpful in bridging those who need more hope or direction for the workforce, and where we are seeing so many employers need that workforce ready. And maybe the last one that I thought was interesting for me, and you all brought up some examples, is the idea that really, whether it's individual or in policies or in the group discussions that you're a part of, there is something all of us can do as we leave these great presentations and think about what can we take from this, whether it is, some of those programs and connecting people to resources. I loved some of the examples, thank you, Mabel, that you started out with, and some of you also brought up, really empowering so that we all can be a part of creating more hope for all of us to help resolve these issues. So my final thought before I close for all of us is I hope that all of you listening will send your gratitude, your mental gratitude to these speakers and to Dr. Linda Elliott-Nelson for bringing this program to us, and that you might even choose to engage in some of our other programs where you are part of the discussion throughout the state on workforce development. And finally, one more thank you to our financial sponsor, the Nelson Family Charitable Fund, and thank you all for your time. Thank you.